one thing I see very, very frequently in practice is hypothyroidism. It's very common in women. It occurs much more often in women than men. 95% of hypothyroidism is autoimmune hypothyroidism, which is called Hashimoto's hypothyroid. So this is a type of thyroid disease where the body makes antibodies against its own thyroid gland, and then that damages the gland, and over time that gland is not able to keep up with producing the same amount of thyroid hormone as it once was. Conventional treatment of hypothyroidism, there's basically like one treatment that most people have, which is replacement of thyroid hormone. So what that does is it can be very beneficial. It can help people to feel better. It can help reduce the stress on the gland by taking over some of that hormone, like that source of the hormone rather than production from the gland. But it doesn't at all address the autoimmune attack on the thyroid gland, which continues to damage the gland and can cause its own symptoms and can cause other autoimmune issues in the body. So naturopathic medicine is a wonderful option for treating Hashimoto's hypothyroid because we actually address the cause being the autoimmune condition, not just the issue of the thyroid hormone production. So that's a huge thing I see in practice because it's like almost every patient that comes in to some degree, not every patient, but many patients, because I see primarily women, have to some degree issues with the thyroid at some point in their life, and often they're medicated but they don't always feel better. So the way that we can go about treating hypothyroidism naturopathically is by addressing the autoimmunity. I do a series of protocols where we work on addressing different systems in the body to help reduce that autoimmune attack. So usually I spend about 3 months working on like liver detoxification, adrenal support, and gut health. All three of those things have a huge impact on autoimmunity. And then we also look at each individual patient through questionnaires, through our intake, and we look at what has been the root cause or the triggers for that person's autoimmunity, and then we go about addressing those. And often what you can see is within those first 3 months, you can see either a reduction in the amount of medication that someone might need, a reduction in the amount of thyroid antibodies that you can measure, an improvement in symptoms, which can be anything from energy, sleep, metabolism, body temperature, that type of thing. And then what you're really trying to do is prevent future disease and reduce that damage to the thyroid gland over the lifetime to maintain that function, which is really possible by addressing it with naturopathic medicine.